If It's Not Depression Vodcast. I'm interviewing Dr. David Rabin, MD, PhD, who is a neuroscientist, board-certified psychiatrist, health tech entrepreneur, and inventor who's been studying the impact of chronic stress in humans for more than a decade. He is the co-founder and chief innovation officer at Apollo Neuroscience, which has developed the first scientifically validated wearable technology that looks like this, that actively improves energy, focus, and relaxation using a novel touch therapy that signals safety to the brain. Dr. Dave has always been fascinated by consciousness and our inherent ability to heal ourselves from injury and illness. He's right up my alley. As such, he has specifically focused his research on the clinical translation of non-invasive therapies for patients with treatment-resistant illnesses like PTSD and substance use disorders. Dr. Rabin is the co-founder and executive director of the Board of Medicine, a 501c3 nonprofit organization of physicians and scientists establishing the first peer-reviewed evidence-based clinical guidelines to the production and safe use of currently unregulated alternative medicines, including plant medicines. The Board of Medicine trains and certifies healthcare providers and provides quality control standards for complementary and alternative medicines to support high quality clinical research, best practices, and risk reduction. In addition to his clinical psychiatry practice, Dr. Dave is currently conducting research on the epigenetic regulation of trauma responses and recovery to elucidate the mechanism of psychedelic-assisted psychotherapy and the neurobiology of belief. Dr. Rabin received his MD in medicine and PhD in neuroscience from Albany Medical College and specializes in psychiatry with a distinction in research at Western Psychiatric Institute and Clinic at the University of Pittsburgh Medical Center. I know several people working there, or at least worked there quite a while ago. I graduated from medical school in 1990. So a lot of years between you graduating and me graduating. So you're so young and so successful in a short period of time. So welcome, Dr. Rabin. It's great having you here. It's been a little while since I finally got you on my Vodcast, and I'm so happy to finally talk to you about your Apollo Neuro device. And I would love for you to talk a little bit about how you came to bring this into, our world.
Sure. Thank you so much for having me. I really appreciate it. It's a pleasure to be here. And I'm really glad that we could make this work. I know it's been challenging with all of the stuff going on in the world lately. And so I really appreciate making this happen. The way that we ended up coming up with Apollo and the technology behind it and the understanding of it was really in pursuit from roughly 2014 to 2018, and actually going back even further, but looking in pursuit of new therapies that did not have side effects, that were non-drug, that could help get to the core of what is common between many illnesses and mental illnesses and physical illnesses, which to me and to many of my colleagues seemed like stress, right? And that stress itself is so pervasive in our society. It's everywhere. It's so common that and when I say stress, I mean distress or chronic stress that accumulates over time is so common that we often even forget that we're experiencing it, right? And it just becomes part of our life. We learn to be stressed out and we get quite good at it, and quite good at coping in the different ways that allow us to still be functional and maintain our day-to-day responsibilities, and at the same time still have quite a high stress burden on us all. That never really goes away that much, except maybe when we're on vacation, but then we come back and it's there again, right?
Right.
And so this was always interesting to me because it was very clear that stress worsens symptoms of a lot of illnesses, particularly mental illnesses, autoimmune disorders, metabolic disorders like obesity, diabetes, cardiovascular disorders. And we saw that there were these very significant situations where people were stressed, either in the short term or over time, and that stress resulted in worsening symptoms of all these different conditions, and that the physical stress could cause worsening of mental health symptoms, and mental stress and emotional stress cause worsening of physical health symptoms, right? And so they're all tightly interconnected, which was very different than what we learned in medical school, decades ago, was that the mind and the body are very separate. Psychiatry and psychology are taught completely separately from the physical medicine components. We even talk about it like, is it psychiatric disorder versus organic disorder, right? Yeah. A term that I hope phases out very quickly.
I'm sure it's phased out by now.
You'd be surprised.
No, I mean, you're right. You're absolutely right. It's and people don't realize that stress alone can cause all of those medical illnesses, as the ACE study has shown, the adverse childhood events study. Yeah.
And the World Health Organization also, to their credit, right, in 2019, I believe, came out and made an announcement that said, by the way, burnout, which is symptoms of, which many of us have experienced, symptoms of lack of emotional engagement and fulfillment, feeling like emotionally withdrawn, depressed, upset, angry, unfulfilled by our work, low motivation, fatigue, a lot of symptoms that overlap with depression and anxiety are also directly related to work-related stress. And the World Health Organization admits this in 2019 as a worldwide issue that needs to be addressed quickly.
Right.
And so we are starting to finally get to a point in our society where this is accepted, but it hasn't really made it all the way down to practice yet. A lot of industries are still very much suck it up kind of mentality, right? Even medicine, where you're expected to perform at a very high level and ignore your own health, because everybody else is doing it too. And there's a certain sense of toughness that is instilled as requirement to get through.
Right.
And so basically in that arena, starting to understand that, when we're treating, as a psychiatrist, treating people with PTSD, depression, anxiety disorders, substance use disorders, over 50% of these people are not getting better with the treatments that we are taught to prescribe and taught to recommend. And the treatments that do work, which is intensive psychotherapy with management medications together, are very, very intensive and require a lot of effort on the part of the client. And so have very poor adherence rates. People drop out of treatment.
Right.
And so what we were trying to do was to say, okay, perhaps there's something else going on here we're missing. If more than 50% of people with PTSD are not getting better with the gold standard of care, which actually came out of, or in large part came out of Western Psychiatric Institute and Clinic, where I trained in the University of Pittsburgh, then maybe we don't have this quite right yet, right? Maybe there's another way to look at mental illness and illness in general, or dis-ease, right? As a result of chronic distress. And so we started to look at the nervous system, and we started to look at the way the body responds to stress. What happens to the heart? What happens to the lungs? In terms of in the moment, right? When you get stressed, your heart rate goes up. Your lungs start to take deeper, faster breaths. Our blood pressure goes up. Our body starts to divert energy and resources to our skeletal muscles and our heart and lungs and our motor cortex of our brain and our fear center of our brain, and all the parts of the body that help us to get out of a threatening situation. At the same time, that's really important, but it also takes resources away over time from our reproductive system, our digestive system, our immune system, our creativity system, all the parts of our bodies, empathy, right? All the parts of our bodies and our mind that are not useful or deemed useful for fight, flight, or freeze, right? Survival, are deprioritized. And so you would expect that it would make very much sense that chronic stress over time would lead to disease or dysfunction in those systems that are not getting resources. And so we thought, well, what restores balance to that system? Soothing touch as the oldest technique, soothing music as slightly newer, eye-to-eye contact and empathic listening from somebody who's another caring human being that is listening to you non-judgmentally, any number of things, right? Yeah. Meditation, deep breathing, yoga, exercise, all of these different things start to rebalance the system. So we thought, can we tap into that system with a wearable as a therapy rather than as something that just tracks you? Can we give you something that you can wear that activates that safety system through the skin to rebalance the nervous system in a way that's similar to deep breathing or meditation or soothing touch, but without you having to rely on someone else and without you having to take a ton of time out of your day to do it.
Right, right.
And that's where the idea of Apollo came up.
I was particularly interested in it because, I teach patients to meditate and do, vagal nerve activation exercises and all sorts of modalities that require a certain amount of learning curve and practice to be able to do it, and requires time and a significant investment of time. And sometimes people are so stressed out that they can't organize themselves to be able to even engage in these activities to the degree that you need to engage in them in order to affect a change. And so it would be helpful, other than giving people benzodiazepines, to calm their nervous system, or supplements like GABA, and that kind of just takes the edge off, but doesn't actually fix anything. It would be really helpful to have some kind of device that just requires putting it on your wrist to affect a change in the body internally, so that at least to get them to a place to start using some of these, learning some of these modalities.
Yeah, you're absolutely right. And I experienced exactly the same thing with my clients, and my colleagues experienced the same thing, which is now well documented in the literature, which is that if you're already stressed out, or you have a significant illness that has a significant impact on your life, mental or physical, the likelihood of you successfully making change without reducing some of that stress and implementing that change over time is very low. Because when we're stressed out and even if we don't consider ourselves threatened, but our brain does or our body does, right, then our body and our brain are opposing change itself. It doesn't matter what that change is. That's why we go back to old habits, because old habits are familiar. And when we think about the amygdala, which is that fear center in the center of our brains, the amygdala is often thought of as only a fear center, but that's not true, right? It's really a contrast detection center. So it's detecting familiar and unfamiliar. Mm-hmm. And when we're threatened or in a state of perceived threat of any kind, it could be traffic, too many emails, too many kids screaming, too many responsibilities, too much news, whatever it is, that perceived threat directly opposes change and nudges us down a familiar path, which is not necessarily a path that's serving us. That familiar path could be stuffing our faces with food for immediate relief, or it could be going, smoking or drinking or any number of other things that are not necessarily constructive. So if you can help somebody feel safe, even with just, again, a handhold or holding a pet, or playing some soothing music, or eye-to-eye contact, or Apollo, or any of these kinds of things, then what happens is the mind and the mind comes back into the body. People start to feel a little more present, a little more connected to their bodies, and safe enough to make change in the first place. And that's when things really start to go down a positive feedback loop of healing.
Right. And it's a way to get out of that vicious cycle.
Right. And the cycle can be vicious in either direction, right? So it could be a negative cycle where we're constantly feeding these familiar bad habits that are not serving us, that make us ill and make us feel like crap, like the drinking and the eating bad food and the not exercising or binging on TV shows or whatever it might be. And then, or overworking ourselves or playing video games too much or whatever it is. And then we can reset that cycle to positive strategies like yoga, deep breathing, exercise, meditation, soothing touch, music, etc. But it requires a certain grounded balance to get there. It's the stuff that we practice doesn't stick unless we have a foundation for it to grow on. And that foundation is safety, right, or fear. If we're acting from a foundation, a set point of fear, then our actions will be fear driven, right? They will be threat driven and geared towards a sense of survival. But if we're founded in a sense of safety, then our actions are geared towards thriving and really enhancing our lives and the quality of those around us as well. And that is across all fields of medicine, but Eastern, Western, and ancient tribal medicine, they all talk about that same foundation, which is really, really interesting. So Apollo was incredible to when we first discovered the technology behind it. We didn't have a company, we were just scientists working in a lab at the university, and to be able to see that we could influence the autonomic nervous system, the heart rate, the breathing, and the blood pressure and that kind of thing, but also see that when you give somebody a little boost of a gentle vibration on their arm or their leg or their chest, that they actually perform better under stress, right? Their cognition gets better. Their physical performance and recovery gets better. This is in healthy people, not sick people, right? There's actually a correlate between how people say they feel and what's going on in here, right? And how we end up performing in the long run. So the idea is get all of that stuff aligned so that where all of our systems are working together, not against each other.
Right. Yeah. So tell us how, what's actually happening in the body when you actually put this on your wrist or your ankle. I know you could put it on your wrist or your ankle, wherever you're most comfortable, I'm assuming. Yeah. Tell us what actually happens in the body when that.
Sure. I can use myself as an example, because those of you who have heard me speak or seen me on podcasts, most people would never guess that I ever had any kind of performance or presentation anxiety, but I did. And what I realized from using Apollo for that, starting when we had our first prototypes that were wearable about 3 years ago in 2018, was that I was spending most of my time on stage thinking about what other people were thinking about me while I was talking. And when I started to talk to other people and start reading about performance anxiety, I realized that thinking about what other people think about you when you're talking or doing anything is not helpful, because we don't have control over what other people think about us. What we have control over is how present we are with what we're bringing into the experience. If I am diverting my precious cognitive resources, whatever percent of them, to thinking about what other people are thinking about me while I'm presenting, then I'm taking those resources away from the task at hand, which is just being present and presenting what I have to say, right? Which makes me give a better presentation. So using Apollo in those experiences was really fascinating, because I would be on stage and I'd be giving a talk in front of all of these peers, colleagues, other doctors who are much, much more senior than me. And what happened was I was able to bring myself into a state that I normally could only access with deep breathing, which was challenging for me because I never learned how to do it properly. And I started to notice that I was in the moment. It was like a flow that Apollo could induce for me when I was on stage, or in social situations with people I didn't know and I was tired, right? Or when I was in the psychiatric ER, I was seeing very, very difficult patients one after the other, and I only had like 5 minutes to recover in between. The Apollo, feeling the vibration of Apollo, reminded my body that if I had the time to feel this vibration, I couldn't possibly be running from a lion in that moment. And that soothing vibration also is delivered to the body at a rhythm that reminds us to breathe. And it's the ideal breathing rhythm that we access during biofeedback and standard basic early meditation practice.
Oh, wow.
So it's based on a traditional biofeedback understanding of how we can see or hear or feel something like music, and it can change our breathing pattern, our heart rate, or our blood pressure just by experiencing it. And when we didn't know that it would work, but based on all the biofeedback literature and all of the literature on the effects of music and touch on the body, in 2014 through 2016, I mapped out the entire touch pathway from the skin to the brain and said, okay, if this is what we know about how like a purring animal or somebody holding your hand or giving you a hug could signal to the brain that you're safe enough to be calm and present in the moment and make decisions from a standpoint of strength rather than threat or fear, then it's possible that if we get the right frequencies of vibration, then we could potentially activate the touch receptors to replicate a lot of that effect. It's not the whole effect of touch, but we could potentially get a bunch of it. And then we just started testing and testing and testing, kind of like Edison in the light bulb lab, right?
Right.
And finally, we found a couple based on the breathing patterns from biofeedback that really made us feel good. And then that became the clear and focus setting, which was the frequency pattern of vibration that I used to fix my own performance anxiety.
Right. So I noticed, like, I'm just going to show the audience that this is an app. The app actually looks like this in the corner, right there. And so when you press the app and open it, it shows a screen of all of these different
modes. They're like states or modes.
Okay, yeah. And so I've tried a whole bunch of them, and they're different lengths of time. Some are 5 minutes, some are 30 minutes. I think one is 60 minutes. And sleep and renew, relax and unwind, meditation and mindfulness, clear and focus that you just mentioned, rebuild and recover, social and open, energy and wake up. The energy and wake up is 5 minutes. And
you could change the time for each of them.
Okay. Yeah. So I'm curious, how did you decide to make them? Are they different? Because I noticed there's rhythms that are different from different. How did you decide how to make them different? How did you?
Just experimentation, right? So the only way to know what's going to happen, and this is one of the biggest faults of any company that is making human technology or whether it's a drug or whether it's a wearable or anything in between, is there's not enough experimentation in the process at the early phases. And we didn't have a company. We didn't have any personal money invested in this. This was a research project. And so for us, everything was about experimentation so that we could understand, is this worth putting more time into, right? I have another job. My wife, who's now the CEO of Apollo, has another job and another career. None of us need this for our lives, right? This is going to be a labor of love if it actually does prove to work. And so we basically took all of the rhythms. We were all musicians originally on the research team. So we had a fundamental understanding of how music changes the way we feel. And we knew, and it's very clear from literature as well, that fast-paced music that is used for dancing or working out or things like that, increase heart rate and increase blood pressure and breath rate. And slower paced music does the opposite and helps people wind down for meditation or sleep or relaxation. And most people would never switch those musics, right? You'd never listen to slow, soothing music when you're working out, and you wouldn't listen to fast-paced music when you're falling asleep, because it would be destructive. And so what we did was taking an approach as if we were composing music for the skin touch receptors instead of the ears. We started to compose and basically composed a set of patterns based on the natural rhythms that the heart and lungs get into when we start to enter a meditative state or a flow state, which is somewhere between 5 and 7 breaths per minute, depending on the person. And this is well known in the biofeedback literature. And from there, we then took 40 people, and this is back in the first double-blind randomized placebo-controlled trial in 2017, that wrapped in 2018. And we took 40 healthy people and threw them into the lab in a very highly controlled setting, soundproof and electromagnetically shielded room, doing brainwave analysis and galvanic skin response, which is sweat analysis, and heart rate, EKG, respiratory rate, pupil measurements, everything all in tandem with resting states, threat states, stress tasks, et cetera. And then we just asked people subjectively how they felt and measured their bodies at the same time. And what was very clear is that even from the 40 subjects who went through this, the results from the reporting and from their bodies were so consistent across most of the people in the study that it became very clear that we were onto something in terms of the way that these different vibration patterns were composed, and that there were certain patterns like music that clearly boosted energy and boosted heart rate and boosted awake attention. And then there were other modes that boosted recovery but still help people focus. And there were other modes that made people really calm and sleepy and tired. And from there, and then we started to look at those modes. After that study, we found a couple that boosted cognitive performance in that particular trial very significantly over placebo. And when I say very significantly, I mean up to 25% more accuracy on a cognitive performance task that is extremely challenging. So you can imagine getting 25% more accurate, more questions right on like your SATs, for instance. Like that's a huge jump from just wearing a vibrating bracelet because it calms you down and reduces test anxiety. I mean, that's a big deal.
It makes a difference between a B and an A.
It's or maybe more, right? It's a huge difference. It would have made the difference between me getting into all of my first choice schools instead of my second choice schools, right? Which is fine. It didn't really make a difference. But the point is that we see it as making the anxiety, the level of stress makes a big difference.
Absolutely.
And so from there, thanks to the work of Catherine, my wife, we had just been married in 2016. And she had all the business background and of emerging technologies and getting things out of the lab and into the real world. And she was like, I'll take a look at this and see if I can help you because it sounds promising. And then after that, those study results came back, she raised us enough money from the university to make 400 prototype wearables that were really, really rudimentary, but they worked. And we started using them and tested them in ourselves and across about 2,000 people. And then asked them what the effect was, and we tracked the frequency patterns they used and why, and then we were able to refine the 16 or so modes that we gave in the beta prototype phase down to 7, which now are the 7 that are in the commercial device, and every stage has resulted in more iteration and getting more accurate. So in the lab, we hit 80% of the healthy subjects responded from 2 patterns. In the beta testing phase, we got closer to 85 to 90% with the prototypes. Now we're hitting 90 to 95%. And as we get better from learning more about our subjects, the customization and personalization continues to improve, and the response rates improve as well, which is really interesting. And we learn more about how people use Apollo. So the reason why this is interesting is because people use Apollo more for sleep than any other thing. And when we made Apollo, we made it for focus and cognitive performance. Turns out people use it for that, but they really, really like it for sleep.
That's great.
So we actually learned so much about our market from just taking the time and doing that experimentation and seeing what will people use this for and what do they want out of their technology.
So have you published some papers based on your results?
So the publications are all in the publication process. Unlike most companies, we don't take any financial or otherwise interest in the academic publication process because we want to remove all corporate influence and conflict of interest from the process. And that's a big problem with companies in science, where companies will fund the science and then have what's called last right of refusal on the publication, so that if a study happens and the results aren't good, they can say, no, sorry, we're not allowing you to publish that. We don't do that. So we allow the universities and the clinicians and the academics to do the work. We provide them with the tools, we give them everything they need, the tech support and all that to do it, and we help them with any study design stuff they need, but we are hands-off with the data analysis and we're hands-off with the publication, which makes it take longer. However, when things get published, it's conflict of interest free. So we have not had any say in what is said or how it's said, which makes the research more valid. So it seems like, it's hard to say with the academic publication timeline because they're very slow, but we have 4 clinical trials done to date. Most of them were done at the University of Pittsburgh. 3 of them are in the publication press process currently. We're hopeful that the first one will actually come out this year, followed by several more coming out next year. And we have 9 more trials currently underway at a number of different academic institutions around the country, which is very exciting.
That's fantastic. Yeah, that's fantastic. Which psychiatric symptoms or disorders are you finding this device to be the most helpful with?
So I can tell you that the folks who respond the best to Apollo, interestingly enough, are people who have had some kind, who either currently have significant stress in their lives from day-to-day responsibilities or what have you, or and just being overwhelmed in general, which often reflects young women and mothers, right? By nature of the responsibilities that mothers have in the world these days. But general across people who are very stressed out in their day-to-day, those people tend to respond very well. And then people who have had past trauma respond very well. And this is kids and adults. And it's not really diagnosis specific, which is really interesting. Obviously, we're pursuing, because of the incredibly positive results we've had in clinical populations, we are pursuing FDA clearance for Apollo for different indications, like PTSD and pain and ADHD. At the same time, what unites all of these people in their response to Apollo, which many of whom are also the folks who work with are veterans, these people have all had some degree of traumatic events in their lives or are in the traumatic process in the moment. And those people tend to respond the best to Apollo. Whether the symptom, the expression of symptoms looks more like in the DSM diagnostic categories of PTSD or ADHD or depression or anxiety or insomnia or personality disorder, it doesn't necessarily matter. And I think the NIMH, the National Institute of Mental Health, is coming around to this thanks to the RDoC domain criteria that is shifting the way we look at mental illness, which is amazing. That's coming around now to be sort of outside of diagnosis, rather looking at the commonality between illness.
Looking at root causes.
Exactly. Looking at root causes.
Yeah. So the DSM says nothing about root causes. It's just compilations of syndromes or symptoms to create a diagnosis, but it says nothing about root causes. And what you're talking about, child abuse is not, or trauma is not a diagnosis in the DSM. And so I completely agree with you that, so depression and anxiety would probably be included in that category because trauma does cause depression and anxiety as well. Right.
And so trauma, if you believe in or a subscriber to the Hippocratic origination of the Hippocratic approach to Western medicine, which of course the Hippocratic oath we all took to become doctors, which starts with first do no harm. And then also the Eastern philosophy of medicine and the tribal philosophy of medicine, they all talk about trauma being some kind of trauma that could be completely subjective to the individual, is at the root cause of most illness. And here's the kicker that Gabor Mate talks about a lot, who I love the way that he describes this, is that one of the most fundamental traumas that we all face, which we, of course, most of us are not taught or to think about as a trauma, is that we're often taught from a very young age that there is a version of ourselves that is worthy of presentation to the outside world and worthy of love and affection and acceptance. And there is another version of ourselves or parts of that self that are also ourselves, they're part of us, but they are not worthy of presentation to the outside world. They're not worthy of love and affection and acceptance from our environment and our communities. And that separation of self or parts of ourselves into two versions of ourselves, one we keep to ourselves, and the other one we present to the outside world, is what many believe traditionally is the source root of much of the trauma that we experience in our day-to-day lives, because it creates at the beginning of our lives a fractured sense of who we are.
Right.
And so much of our work as therapists and psychiatrists, if you're a psychiatrist that does therapy like me, is about helping repair that fracture. And that's where Apollo comes in, because Apollo's goal in Soothing Touch is about these safety techniques for recovery are about helping us feel safe again in our own skin, helping bridge the like splinting a broken leg, right? You're basically providing something that helps hold those fractured parts together a little bit in the body and the mind together, not separate, body and mind together with emotions, with heart, with spirit, all as one entity that heals together. And when you bring all those parts together aligned, people tend to heal a lot more quickly than when they're fractured.
Right.
And
Yep.
psychedelic medicines also can be used in the same manner.
Yeah, and we're gonna talk a little bit about psychedelic medicines in a minute. I do want you to, if there's anything else that you want to say about the Apollo for our audience to know about that we haven't covered, now's the time. What else would you like to say about it that we haven't mentioned?
I don't know. I think we've covered quite a bit. I mean, I would say the main thing is that, well, check it out if you're interested at apolloneuro.com, and feel free to reach out to us if you have any questions. We love hearing from everyone and answering any questions that you have about it. It's a new kind of technology, so we understand that there's a little bit of a learning curve. Most wearables don't give you therapy. They don't change the way you feel. They track you. Right. So Apollo is a digital wearable therapeutic. It's literally the first of the third generation of wearables that does not just track you. Yeah. And that is a generation that is really exciting to embrace. And I think it's going to really change the way we look at health.
That's a great distinction. And how long can people expect to see a change? How long would they have to wear it? And is it something that they can, the question that I had, is it something that they can wear all day long and have it working continuously? Because you said the time can be changed, right?
Yeah, so we've set it up to try to encourage people to use Apollo intentionally, because the more, like anything we do, the more intention you put behind your actions, the more likely you are to achieve your goal, right? Mm-hmm. So if your goal is to be social or to do focused work or to go to sleep, and you set your Apollo to one of those modes that helps nudge you in that direction, then you're more likely to accomplish your goal. If you are planning to go to bed, but then you have an espresso, you're probably going to be less likely to accomplish your goal, right? So people often use, so in terms of the amount of time it takes to get an effect, everybody's different. We have some people who respond to Apollo lickety split, they feel it right away. We have other people who feel it over the course of a couple of days, and then we have other people who feel it over the course of a couple of weeks. And then we have other people who are these really kind of stoic, high achievers, very high performers that are really interesting population that notice nothing on the daily basis. They note, or they notice very little, if anything, over the course of many weeks, like 4 or 5 weeks. And then they reach out at about 4 or 5 weeks, and I have a lot of doctors who contact me about this, and they reach out and they say, I didn't notice anything when I first started using this, but now I've been using it like almost every day for the past 4 to 5 weeks, and I noticed that I'm not as reactive to stress anymore. Things that used to set me off, I can approach with calm, and I'm just like, I'm in my Zen mode. And I'm like, and that's really cool, right? Because you're conditioning the nervous system over time. And that's basically what we see. That effect is funny in those people because they don't notice the daily like I do, or like many of us do. But if you're using it intentionally in a moment where you're trying to achieve a desired goal, or trying to manage a certain stressful situation like a presentation or an interview or running a meeting or sitting in traffic or having to socialize when you're tired or doing any of those kinds, or wind down when your mind's racing, you're trying to fall asleep, that's when people typically tend to notice the biggest, most immediate difference. Yeah. And that accumulates over time. So we've now seen that as people use it over the course of a year, they actually get cumulative benefit, which is really interesting. So cumulative in a subjective sense, where they feel like the Apollo, they feel the effects more quickly when they turn it on, and they last longer, and they use it but they use it less, not all day, every day, even though you could if you wanted to, and many do. But we also see their biometrics improve cumulatively. So we see HRV, heart rate variability, cumulatively increasing over months. We see resting heart rate cumulatively decreasing over months. And we see deep sleep, REM sleep, and total sleep increasing over that same time frame in a very clinically significant way, which is really exciting. So the amount of use does relate to the improvement, but the intention of how it's used is also very important.
So the intention is a very big part of it. So using it all day, every day without intention probably wouldn't give results, or do you think there's still benefit in doing that?
So I think it gives results, and we do see that it gives results, and the people who use it more tend to get better biometric changes over time, especially in the short term. However, to your point, when you use it more intentionally, we tend to consciously notice the change more. So if you use it all the time, then it's always on. You may not be as aware of the change when it happens. But if you're using it sporadically, like say I use it for half an hour when I wake up because I'm a little sluggish in the morning, and I use it half an hour before lunch because I'm tired, and then I use it half an hour after lunch because I have the post-lunch slump, and then I use it half an hour to socialize after work, and then half an hour before bed, then that kind of sweet spot of 2 to 3 hours of use a day is more likely to get you not only the cumulative effects, but also you're more likely to notice it when you're using it.
Right. And you can be active while you're using these programs as
well. For sure, they're totally passive.
Yeah, I don't want people to think, oh, a half an hour before lunch, I have to sit there with this wearable on, or a half an hour after lunch, I have to sit there with it. You can be active and go about your day and do whatever you need to do. But there is some intention around doing it and doing it in spurts, it sounds like, as opposed to wearing it 24/7. I would imagine that that at some point you would become tolerant or not notice the sensation anymore if you, I think, did it 24/7. Not that it wouldn't work, but it probably works better when you actually have an intention to notice the sensation as it's happening.
Exactly. So if you want to notice it, I think you said it perfectly. If you want to notice it and be like really aware of the change, use it intentionally, or as intentionally as possible with your goal, right, and align it with your actions. And if you want just consistent sort of tonic benefit, then you can wear it all day, every day. I mean, most people who have an Apollo, I would say, wear it all day, or all night, or both, but they don't necessarily have it on vibrating all the time. You can usually, what I'll do is I'll set it in the morning to clear and focus, because I have a lot of different things that I do, so it just keeps me in the zone and allows me to drink less coffee. And then I will have that on, and then I'll use it for half an hour, and then I'll go a half an hour without it, and I'll be like, oh, I'm feeling a little sluggish. I'll reach down, tap the buttons, turn it back on to the clear and focus mode. I'll get another boost. And then that offsets what I would normally do in my medical school days of going and getting another cup of coffee, right? And then I don't disrupt my sleep in the end of the day because I'm consuming less stimulants during the day. Right. And so it has that benefit as well of just kind of providing a little bit of a boost, which ends up having longer term circadian rhythm benefits as well.
Right. And so then you can, is it possible to set it all day if you wanted to actually have it vibrating throughout the day?
Not yet. We will be releasing, and we're testing right now a very special feature that I'm excited about, which is allows people to schedule the modes. So you can actually set up your whole week in advance if you want, and then have that repeat, which is awesome. But that's still in testing. So, and it will be a software update that will be available to all the devices that are currently in the wild. That being said, to try to encourage people to use it intentionally, what we've done is we've allowed the device to be disconnected from the phone. So, and that happens by default. So when you turn your Apollo on, whatever mode you set it to is mapped to the device buttons. And you can restart that mode without going back to the app. So that little built-in feature actually facilitates intention just by forcing you to reach down to your wrist or reach down to your ankle and reactivate the device with the buttons. It forces people to think about what they're doing a little bit more, right? And so so right now you can't set it all day to turn on the battery. It's really to conserve battery and to make sure that people get, have it available when they want it to be available. It's there and it has a charge, because otherwise people just turn it on and leave it on forever. And we tested that too, and that did not. It took away from the user experience. So allowing people to have that button functionality makes a difference, because then you can still activate it with just one click of both buttons. You can turn it back on, but you conserve battery so that when you need it, it's there and it still has charge left over. Hopefully.
Understood. Yeah. Oh, it's so exciting. I'm so glad that you did this work with your wife. I think it's going to be awesome for a lot of people. I'm looking forward to seeing how it evolves, and it's so exciting. I'm really happy for my patients. I'm definitely going to let some of my patients know about this, and maybe all of my patients know about it. I'm sure everyone could benefit from it. So yeah, let's shift gears a little bit, because I know you're also doing some work with psychedelics. And you're interested in the possibilities of using psychedelics for psychotherapy. And I was wondering if you could just, talk about the benefits and how all of this can be done. I think we have time for that.
Sure. Yeah, so it's a good question. And, psychedelic medicines are commonly misunderstood and have been around for actually a very long time and used medicinally by ancient cultures for untold amounts of time. Psilocybin mushrooms have probably been used in healing ceremonies by tribal cultures in Mexico for 10,000 years, maybe more. Mm-hmm. So these are substances that have been well cataloged and studied, at least the plant forms of them for the most part. And interestingly, more recent, and then of course, LSD was discovered in the 40s by Albert Hofmann, and then started all these research programs into LSD for mental health purposes and physical health purposes at Hopkins and Harvard and NYU and all these really famous institutions around the world were doing it until the medicine got leaked out to the public, and unfortunately conflated with the anti-war movement with Vietnam, and then everything got banned, right? Which was a hugely unfortunate turn of events. And so now, since then, there's certain medicines that have continued on to be studied in medicine for treatment-resistant mental illnesses, in particular PTSD and depression. And one of them that is most interesting that a lot of people don't know much about is called ketamine, which is it's the only legal psychedelic medicine. Mm-hmm. It's legal in almost every state. It's legal, in every state and in almost every country in the world, because it was developed as an anesthetic agent. Actually, one of its first uses was to evacuate soldiers from the battlefield in Vietnam. And it was found down the road over the last 40 years to have some fairly potent antidepressant effects. Mm-hmm. And so even with the drug alone, medicine alone has some fairly potent antidepressant effects that could last for a couple of weeks after one dose, which is pretty interesting, even in people who are severely depressed and severely suicidal. And so that started off this sort of craze of ketamine infusion clinics and all of these places where people can go and get ketamine. But like all psychedelic medicines, and by psychedelic, I mean not crazy 70s dance party, but actually like what psychedelic means is psyche means mind and delos means to show. Mm-hmm. So these are medicines that show us our minds. They show us our subconscious minds that allow us to pull information from our subconscious, which is all the stuff that our bodies and minds remember that we call beneath awareness, and pull some of that into our awareness or our conscious minds, and then integrate it into our wholer sense of self.
Right.
So ketamine is one tool that allows us to do that as well. Sorry, I didn't interrupt.
Yeah, no. I was interrupting you. So yeah, ultimately that's the whole purpose, is to, as you talked about, the fractured self into integrating the two parts of you or several parts of you into one whole self. Ultimately, that's the goal.
Right. And embracing the weak parts or the parts that we perceive as weak or vulnerable or afraid or ashamed or guilty. Or wrong. It's really about, meeting those parts where they are, and with compassion, with gratitude, and with love, despite the fact that they might be painful. But like a physical, like cleaning out a wound, right, and stitching it up, healing hurts, right?
Right.
Healing is not always a smooth path.
Right.
But to expose the wound and to have it heal without a scar, like a physical wound, emotional wounds also need to be cleaned. They need to be addressed. They need to be washed and stitched up. And we need to be the ones who go in and do that, hopefully with some assistance from our communities or family or a clinician, but the process is the same. And that's often confused by a lot of the Western medicine community, and unfortunately due to a lot of miseducation and propaganda, but that's basically the gist of what we're doing.
Right.
And it really works. The results are really outstanding.
That's fantastic. So have you been using the ketamine or psilocybin for assistance in psychotherapy?
So psilocybin and MDMA are currently very promising medicines in clinical trials with the FDA. They're in phase 2, phase 3 clinical trials, and anticipated to be available for use in office with a clinician or 2 clinicians by 2023. However, they are currently illegal to use in practice. Unless you're part of a clinical trial, I as a psychiatrist or you as a doctor could not legally administer psilocybin or MDMA or any other psychedelic medicine outside of ketamine or to a patient legally. We could lose our license for it, in fact. And so I do not administer anything other than ketamine, but ketamine is really nice because it's very short acting. You can get it from a pharmacy, shipped directly to a patient's house or shipped to the clinic, and you can administer it in the clinic. And it's the same every time, basically, right? And it just creates a certain reliability and consistency that we don't yet have with some of these other molecules that are not pharmaceutical grade and commercially available and legal. So at this point, I practice entirely a ketamine-assisted psychotherapy program that I also train people to do, that was taught to me by Dr. Phil Wolfson, who is one of the leaders and founders of ketamine-assisted psychotherapy, who still has a practice as a psychiatrist in the Bay Area. Wonderful, wonderful guy, who does great work, and I'm so grateful for his teaching. And he also runs training programs. So for anyone who's interested in this work, highly recommend check out, of course, MAPS.org, which is the Multidisciplinary Association of Psychedelic Studies, and they have their protocols for MDMA-assisted psychotherapy for free on the website that you can read. But also go to the Ketamine Research Foundation.org and look up Phil's protocols and his programs for teaching, and look up the ketamine papers, and you can already start learning about all the stuff and how to do it. Especially if you have clinical training, it's not a huge leap.
Right. Yeah. As a psychiatrist, that's certainly a viable option for me as well. Yeah, it's something that I'll look into. I'm really glad that you informed me about that. So where do you see this going in terms of what conditions that you find these methods valuable? And is there specific things that you've noticed improve?
Yeah, so that's a really good question, right? So maybe taking it back to what we were talking about earlier, which is root cause analysis, right? If you think about many illnesses, particularly, let's talk about mental illnesses for the time being.
Right.
If we think about like PTSD, post-traumatic stress disorder, depression, anxiety disorders, substance use disorders, insomnia, as often having, even ADHD, as often having a root cause that is related to trauma, whether a person remembers the trauma or not, or sees it as trauma or not, does not matter. But if we understand that the evidence to date points to trauma, some traumatic event or multiple traumatic events or stressful events being at the core of what ultimately resulted in those symptoms, that presentation of symptoms that we call depression or anxiety or what have you, then psychedelic medicines are really powerful because they help us get to that root cause, because they can amplify the safety that we provide in the office biochemically, right? So if I can help you feel safe as a client by looking you in the eye and smiling when you smile and nodding when you nod and doing good empathic listening skills, right? Making you feel heard and non-judged, then you'll tell me almost anything. You will tell me, or anything that you would not tell anyone else. That's the whole point of doing the work that we do, right? Is to build everything on a foundation of trust.
Mm-hmm.
But if that foundation of trust is fractured, then the healing process is obstructed.
Right.
So that foundation of trust is particularly fractured by trauma. And people stop trusting themselves when they've experienced one or multiple traumas. They start seeing themselves as a victim rather than an empowered agent of their own healing, right? And so what the psychedelic medicines do, like ketamine or MDMA or psilocybin, is they provide a biochemical catalyst, that safety that we offer in the office to a person or over Zoom, by holding space for someone, and biochemically enhances that safety. And enhancing that safety allows that person in their body, in their mind, to bring to be centered, allow their mind back into their bodies, to be present with themselves, to feel comfortable and safe in their own skin for possibly the first time and longer than they can remember, maybe the first time ever, and to feel what it feels like to have self-acceptance, radical non-judgment, and to just be okay with being me, right?
That sounds amazing.
and that's something that has been the goal of psychotherapy for generations. But when the trauma is so deep, and sometimes it might even come from a past generational trauma that we can't get to the root of, the talk therapy alone can only get us so far.
Exactly. There's
right?
limitations in psychotherapy that you have to get to a deeper level emotionally. And sometimes there's so much resistance there, or resistance that you're not even aware of, that you can't get past, that it's great to be able to have a method to be able to do that. So you mentioned Zoom. So are you able to do this over telemedicine now that especially with what we've gone through in the past year, lots of people are being seen on Zoom. Do you find benefit even out of the office?
Yes. So legally, because of the legal status of ketamine, currently we're able to use low dose oral ketamine that's delivered from a pharmacy to someone's home, and do Zoom sessions with qualified clients over the interwebs, which is really incredible because it dramatically decreases the cost of the treatments. And it also improves the comfort and access to the treatments because people can get them from their own homes. And oftentimes the clinics where these treatments are offered are not near somebody's home. And it's a pain to have to go in every time and be in a foreign environment when you're going to be in an altered state of consciousness, right? So if you could feel safe in your own home, it's not the same as coming into an office, but I would argue that based on having done this now for a while and seeing the differences and similarities between in-person and remote, if the clients are engaged and screened well to make sure that they're not high risk, then you could easily do at-home sessions over Zoom, and people do extremely well. They do as well as I've seen anyone do in the office, in some cases better. And it's really, really interesting. And you also get to sense people are more comfortable in their own homes. There's a certain comfort of being in your own space. And people don't miss as many appointments.
That's true. You're right. People definitely find it much easier to be on Zoom as opposed to coming into the office. It's more time efficient. You can do more things in the day, not have to block out your entire schedule. I've actually had Zoom sessions with some of my patients in their office, where they just close the door. They have just like with any appointment, right? You close the door. I'm having my therapy session now.
Yeah.
Right in the middle of the day. So what about ketamine orally without a therapist? Do you see any benefit in this area without necessarily having to have taking it during a session?
So that's a great question. So I think to go back to something I was saying a minute ago about how ketamine and how psychedelic medicines work, is that they are very, very powerful tools. And they are, the best way to think about it is what was one of my favorite descriptions, is they're non-specific amplifiers. Mm-hmm. So part of the reason I use the word safety so much a few minutes ago is because safety is the most critical foundation, and trust as it relates to safety between me and the client, and the client and themselves, is the most critical part of the experience that has to be well-founded for these experiences to go well. If a person enters into an experience where there's distrust of the provider, or the client doesn't feel safe in any way, then the medicine can amplify that distrust and that fear, right? So it's absolutely critical that safety, the same safety that we would focus on developing in a trusting relationship with any patient, is even more highly prioritized in the psychedelic therapy experience, psychedelic-assisted therapy experience. So with that in mind, and to answer your question that you just asked about home use of oral ketamine, it is absolutely a thing that people can do. And actually, the way that our practice works is that we want, our aim is to get you, the client, to be able to feel in control of your healing experience as quickly as possible, which means that we will do the therapy sessions with you and the integration and the preparation, et cetera. And we will do 1 or 2 ketamine sessions with you over Zoom, with the goal of teaching you how to do it yourself. Mm-hmm. And once we've already screened you and prepared you and given you some nudges on the integration front and how to use the medicine respectfully and curate a safe environment for yourself, it is absolutely a tool that can be used independently, which is so amazing, right? Because none of the other psychedelic medicines at this point have been tested for long enough and have been out in the Western medicine world long enough to be able to be self-administered, but ketamine can. Mm-hmm. And so a typical course of someone that would work with me would be, we have 1 or 2 preparatory psychotherapy sessions, and we do an intake with one of my staff members, get to know you, make sure you're a good fit. We'll do 1 or 2 preparatory psychotherapy sessions to get you familiar with the experience and make sure it's right for you. Then you have your 2 to 3 hour ketamine experience with us on Zoom together. And then you do your integration session. And then you do the ketamine sessions on your own with the medicine that was sent to you from the pharmacy by the exact same protocol that we taught you. And then you do the therapy sessions in between every 1 or 2 ketamine sessions with us. And we help you integrate what you've learned from those experiences. And over time, people really start to like that, because it literally, and that's only for 4 weeks. It doesn't go longer than 4 weeks usually. And it's 2 to 3 ketamine sessions a week for 4 weeks.
Right.
And that protocol gets people to a point that they feel, again, in control of their experience. They're not relying on me. They're not relying on the medicine, because they know the medicine's not going to be there forever, right? And they're not reliant on anything else outside of themselves for their healing process. They see they see the medicine and the experience as a teacher to get them on their path and on their way.
Right. Right. Well, that's fantastic. That's really great news. So this conversation wouldn't be complete if we didn't talk about the risks or side effects of ketamine. Can you speak on that a little bit? I know we're kind of running out of time, so we'll wrap up right after that. What are your thoughts about that? What have your experiences been in terms of side effects and risks?
That's a great question. It's a question that a lot of people are talking about right now, because ketamine in particular, as being the only legal psychedelic, is frequently misused in the community through most often these high dose infusion clinics or injection programs where there's no therapy involved at all, which requires people to have continuously more in medicine and at a greater frequency. So you're getting it more medicine more often, because your body is building up tolerance to the medicine, because you're not having the therapy with it that prolongs the benefit. And so this is not unique to ketamine, but it is unique to ketamine in the current situation we're in the US, because ketamine is the only legal medicine that can be used in this way. Mm-hmm. So in our practice, in the way that we use ketamine with psychotherapy at low doses, we have seen no side effects, because it's used at a very short time frame at very low doses. And then there's large breaks in between when people do when people go back for their subsequent medicine experiences. However, in the clinical programs where people are getting, a couple infusions a week for many, many weeks or months, or they're getting infusions, even once a week for months or years, or once every couple of weeks, we do, and in the recreational community where people abuse ketamine, we do see some, over time, some liver toxicity. We see basically liver inflammation, but most commonly the side effect that is most disturbing to people is what's called hemorrhagic cystitis, which is an inflammation of the bladder lining that results in a sort of painful, bloody urine, which is not pleasant for anyone. And so we really focus on, we have never seen this in my practice. And I worked with Phil for a little bit, Phil Wolfson. I don't think he had ever seen it. He's been doing ketamine assisted psychotherapy for longer than anyone. I don't think he's ever seen this in 10 plus years of practicing this treatment with low dose ketamine. So again, start low, go slow. And if you're going to do psychedelic therapy with any psychedelic medicine, have the therapy as a critical part of it, and know the role of the therapy and do the work. Because ultimately, if you if you talk to anyone who's been through a full treatment protocol with any psychedelic medicine, they will tell you that the medicine is only 20%. The therapy and the integration is 80%. That's why it's called psychedelic-assisted psychotherapy, not psychotherapy-assisted psychedelics.
Yeah, so I'm curious, does the psychotherapy have to be done with a psychiatrist or in conjunction with the psychiatrist? Can it be
Not at all.
Okay.
Yeah, not at all. And in fact, most of the therapy I'm a bit of a rare breed, right? I'm a psychiatrist that also does therapy. I'm trained in 10, both of us, right? Yeah, we're like a very special case. But with most of the people who deliver in what we call integration therapy with psychedelic medicine use are not psychiatrists, and they're not MDs at all. They're psychologists, social workers, MFTs, and people who have psychotherapy training, but who are, or even, I've even seen nurse practitioners do great therapy, but they're people who have a little bit of a medical background, but ideally a lot of a therapy background, that have done some degree of psychedelic training in some way.
Great. Well, I'm looking forward to seeing how this evolves over time. It sounds exciting. And so you're doing great things in the world. Thank you for being Dr. Dave and contributing to the mental health field in the way that you do. It's been really great to hear everything that you're doing. And thank you so much for joining me on my Vodcast to let the people, more people know about this technology and the ketamine assisted therapy. Yeah, so I will include all your information in the show notes for everyone to read about and get to know you better, and hopefully even contact you at some point.
Thank you. And please do reach out. And it's always good to hear from everyone. So Thank you so much for having me. I really appreciate it. It was a pleasure.